Okay, well, I'd like to start by acknowledging the land from which we are calling, the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. The health of these lands and the respect for Indigenous rights are intrinsically tied to the work of the BC Health Coalition. We'd like to thank our partners, Canadian Doctors for Medicare, who are interveners alongside us in the Cambie Case, the Canadian Health Coalition, and the Council of Canadians. I'd also like to thank our speakers today, Dr. Steffie Woolhandler, Dr. David Himmelstein, and researcher Andrew Longhurst. I am going to just do a very quick, brief reminder of the case. We have held this event in order to prepare for the Cambie Surgical Case decision expected sometime this summer. Our public services have been our best defense against the current pandemic and other crises like it. However, our ability to endure crises and care for each other will be forever eroded if the plaintiffs were to win the Cambie Surgical Case. We have been fighting this well-funded legal attack for the past 11 years, inside and outside of the courts. To refresh your memory, CEO Brian Day launched the lawsuit after he learned his clinics were going to be audited by the BC government. The audit was triggered by dozens of patients who complained that they'd been illegally overbilled at Cambie's clinics. Instead of paying back the money his clients illegally overbilled, his clinics illegally overbilled, Brian Day marshaled a group of private for-profit clinics and a few patients who felt they were not provided timely care within the current system to file a lawsuit against the BC's Medical Protections Act. An audit later revealed that Day's clinics had overcharged patients by almost $500,000 in just 30 days. So in front of you is the challenged provisions of the Medical Protections Act. The goal of this lawsuit and these provisions are to let doctors bill patients whatever price they want for all healthcare services, to let private insurance companies sell insurance for publicly covered services. In other words, let private insurance companies offer and deny coverage for basic care like visits to the doctor or to emergency rooms or cancer treatment. Even though this attack has been launched in BC, it takes aim at the Canada Health Act. The Canada Health Act lays out the conditions, including a ban on extra billing and user fees that each province must meet to receive federal cash transfers for health. Provincial laws, like the provisions that are being challenged within the Medical Protections Act, are designed to be consistent with the criteria of the Canada Health Act. If the case were to win, this would make the Canada Health Act and all provincial health protections vulnerable. No matter what the decision is this summer, this case is almost certain to advance to the Supreme Court level. Cambie and Brian Day often suggest, especially in the media, that if this case were to be successful, it would end in a European hybrid type system. Of course, there is plenty of evidence to suggest that these hybrid type systems would be very undesirable to replicate. An example he uses often is Australia. In Australia, where about 45% of people hold private insurance policies, those with private insurance are treated faster in public hospitals than patients covered under the public healthcare system. 42-day waits for public patients versus 20-day waits for private patients for elective surgeries. This is despite laws that say public and private patients are to be treated the same. However, and this is the goal here to mention is, however, the reality is that we share the border with the US, and the evidence within the case suggests a US two-tier system will most likely emerge if the Cambie case were to be successful. Some of the reasons for this are that until the implementation of Canada's single payer system, the US and Canadian healthcare financing systems were nearly identical. Canadian doctors share medical culture with the US. What we mean by that is like educational resources. They often go back and forth in the border to shared medical conferences. Currently, the USMCA, so NAFTA 2.0, indicates that if private provisions and insurance is allowed, US firms should be able to compete. So that would basically guarantee the US private insurance firms coming into Canada. And I mean, strongly, what really needs to be strongly kind of emphasized is we share a border with the US, and our economy is very much impacted by the US. US private insurance firms and their resources coming to Canada is, they bring a lot of resources. American healthcare companies spent, and insurance firms spent more than any other lobby in the US, and are one of the most powerful lobbies in the US, and they would use all of their resources to reshape our healthcare system.